name is Franco, joined by Karine, Naomi, and Thiramagal. Our mentors are Dr. Yang, Dr. Bakong, and Dr. Palyanapan, with Jasmine Choi as a research fellow, and together we are Psychiatry. Cardiovascular diseases comprise the leading cause of death worldwide, yet during the COVID-19 pandemic, Asian Americans saw larger increases in cardiovascular-related deaths compared to non-Hispanic whites. And despite being one of the fastest-growing racial groups in the United States, Asians have frequently been aggregated into a single category in health research, overlooking their heterogeneity. Our research, therefore, aims to answer the question, among Asian American subgroups, how have cardiovascular mortality rates changed in the years post-pandemic compared to pre-pandemic?
We obtained mortality counts from the National Vital Statistics System from 2018 to 2022. This included descendants from the six largest Asian American subgroups, all Asian Americans in aggregate, and non-Hispanic whites as a reference population. International Classification of Disease, 10 revision, was used to identify deaths from ischemic heart disease, heart failure, and cerebrovascular disease. Population estimates were obtained from the American Community Survey for the corresponding years. Two key statistics we generated are the age standardized mortality rate calculated by year, race, and sex for each disease, and the proportional mortality ratio in which we use the standard population as a reference, not non-Hispanic whites.
Moving on to results, we observed an increase in ASMR for ischemic heart disease across most Asian subgroups, with the exception of the Japanese. Notably, Korean females experienced the largest increase between 2019 and 2020 at 50.4%. For heart failure, the most considerable rise in ASMR was among Vietnamese females at 31.6%. In cerebrovascular disease, both non-Hispanic whites and all Asian American subgroups saw increases between 2019 and 2020, with Korean females showing the largest increase at 60.9%. Additionally, the highest proportional mortality ratio for ischemic heart disease was found in Asian Indians, while Vietnamese had the highest proportional mortality ratio for cerebrovascular disease.
While some increase in ischemic heart disease mortality was expected due to the COVID-19 pandemic, the specific groups were surprising, yet consistent with previous research. The pandemic exacerbated pre-existing trends by disrupting healthcare access and intensifying risk factors like diabetes and hypertension, particularly for Chinese and Korean Americans. These findings underline the need of addressing the distinct health differences of Asian American populations. However, there are limitations. Without the joint point analysis, we can't determine if this was temporary or a lasting trend, and the 5-year timeframe may limit our ability to capture long-term trends. So we plan to complete the analysis soon and extend it to 10 years. Finally, our study only covers the 6 largest Asian American subgroups due to data limitations, which points to broader issues in public health data collection methods that need to be addressed as well. Thank you for listening.